Good morning, good afternoon, and good evening, everyone. Thanks for joining today's webinar, which is part of the Quality of Care Network National Forum series. So Olive, next slide, please. So today we have the privilege to hear from Ghana, the Minister of Health in Ghana, the lessons they learned during the National Learning Forum for Quality of Care for Maternal and Newborn Health. The introduction will be done by me, Martin Dolsin, Technical Officer at WHO Geneva. Then we will have a presentation from Dr. Ernest Kunadu Aseidu, which is Head of the Quality Management Unit at the Ministry of Health, Ghana, and also Dr. Mary Ashneo, who is the Deputy Director for the Quality and Safety Management Institutional Care Division from Ghana Health Services. And then as the second part of this webinar, we will have questions and answers, and they will be facilitated by Dr. Rosalind Doe from WHO Country Office in Ghana, and Dr. Priscilla Wubil, UNICEF Country Office in Ghana. Next slide, please. So, briefly around the Quality of Care Network for Maternal, Newborn and Child Health. It's a network of 11 countries, which are mentioned here. 9 in the African region, and Bangladesh and India. The overall goal of the network is to halve maternal and newborn mortality in health facilities in the network countries, as well as stillbirth by 2022. So it's a 5-year period, as the network was launched in 2017. The second goal is also to improve the experience of care. And the strategic objectives to reach these goals are the LALA, leadership, action, learning, and accountability. Next slide, please. So, brief around the National Forum webinar series, which has the objective to document and sharing learning within and between the countries. So the National Forums on Quality of Care for Maternal and Newborn Child Health, it provides a venue for sharing the experiences in countries, from the adaptation and implementation of the maternal, newborn, and child health quality of care standards, and also the quality of care network strategic objectives, to progress towards achieving the sustainable development maternal, newborn, child health goals, and also not least the application of these during the times we're living in now, the COVID-19 pandemic. Next slide, please. So the objectives of the national forums in the network countries, first and foremost, it's to discuss the 4 strategic objectives of the network, and how this has been facilitated the acceleration of the implementation of the national strategic directions for quality of care and the maternal, newborn, child health strategies and plans in the pre and post-pandemic context, or pre and peri the COVID-19 context, I should say. It's also an opportunity to share examples and experiences in implementation of quality of care for MSCH standards, quality statements and measurements, and related quality of care intervention by learning districts, which have been selected and identified by the network countries, and also to discuss implications for scaling up at the subnational and national levels. It's also one of the objectives is also to document the best practices that will be shared at the global level through an inter-country global forum, which will take place next year in October or November, but it will also be parts of other global learning events. And last but not least, it's an opportunity to acknowledge and honor country-level actors and actions that have advanced network milestones, objectives, and improve the quality of care for mothers, newborn, and children in the network countries. Next slide, please. So, through a consultative process, we have identified a few topics around lessons that should be prioritized for the documentation and learning by the Quality of Care National Forums. So next slide, please. These are the ones that were identified through a survey which was sent around, where people could select the most burning issues that they thought around, that they wanted to understand more around the four strategic objectives. So for leadership is around strengthen or build quality of care, health governance, and management structures at national and subnational level, which will then help to sustain the MNH quality of care actions, including linking health system-wide interventions that sustain and institutionalize implementation of quality of care for MNH at scale. For action, it's about linking learning from MNH quality improvement implementation sites with management and decision-making processes at the facility and district level, and also aligning with local health system governments to advance quality of care governance and quality improvement processes. For learning, it's about establish a learning system to support sharing of quality of care knowledge within and also across districts, and scale up quality of care practices from learning districts to other districts in the country. And for accountability, we have two topics which were equally important, identified through the consultative process, and these were to strengthen the routine measurement systems to collect, report, and use quality of care indicators, which will help to sustain quality of care, MNH care. It was also to develop and implement accountability mechanisms that integrate community and stakeholder perspectives. So next slide, please. With this, I would like to hand over for the presentation, which will be done by Dr. Ernest Konada-Aselu, who is the head of the Quality Management Unit of the Ministry of Health, Ghana. So Dr. Ernest, the floor is yours.
Thank you very much. I would like to thank the organizers of this meeting and the opportunity for me to present the state of Ghana as far as this is concerned. So I would initially have to give a little bit of pleasantries here, a bit of introduction. You will notice that on the slide that I was supposed to, where I'm being introduced, I'll be doing the slide with Mary Ashinyo, Deputy Director, Quality Assurance, Institutional Care Division of the Ghana Health Service, who also played a very important role as part of this knowledge forum. So I just want to recognize that. And then I also want to acknowledge the support from the Ministry of Health, from the Honorable Minister, the Deputy Ministers, the Chief Director, and then the entire leadership, the directors of the ministry, most especially the Director PPME, Dr. Emmanuel Dame, and ultimately the unit heads of the PPME. Again, I also want to acknowledge the heads of agencies, both public, private, the regulators, for their critical role that they play during this conference and the knowledge forum sharing. Under especially the Ghana Health Service, I also want to recognize Dr. Kofi Issa, the Director of Family Health Division, and then also Institutional Care Division, Dr. Samuel Kaba, the rest of their team. Most importantly, I also want to recognize Dr. Isabella Sego Moses, who co-chairs the Quality of Care and the Quality Equity Dignity Network of Ghana, who is also on, and generally the various of the teams that have supported making this happen. Finally, I also want to recognize the WHO and UNICEF, who have been the backbone of what we are currently doing in Ghana. They've been very supportive. In addition, so specifically in terms of operations, Dr. Rosalind Doe, Dr. Priscilla Wobil, and Dr. Paul Jani, they've been very instrumental, very supportive, very active in doing this. And together with the entire team from our development partners who have been supporting in diverse ways in the way that this has been currently operationalized. Next slide, please. So the presentation is going to go through these three areas. We're going to look at the structure of the Ghana's National Forum. Then we'll look at some of the lessons that were learned from the forum, which will be interspersed with how the quality of care network has been going on. And then we'll talk a little bit about the next steps, as we move on. Next slide, please. So we're going to move on to the first one. You can see on the extreme left, a very beautiful picture. We want to recognize Ghana Health Service. This picture was taken by Erika Sana, and this was one of the pictures that was also shown during the National Learning Forum. Next slide, please. So just to mention that this is a colleague pediatrician who works in Holy Family Hospital. She has a lot of interest in newborn care and have been quite instrumental, also a part of the Pediatric Society of Ghana. So I'll quickly move on to the conference organization. I would say that this is the first of its kind that we have been able to celebrate or organize this National Learning Forum. I mean, there have been a number of learning forums related to maternal and newborn, a couple of forums or conferences that we do as far as maternal and child health related issues are concerned. But for the network, this is the first time that we are doing this. And the good thing is that it was also in partnership with an existing conference, which is basically celebrating the World Patient Safety Day. So in the last 3 years, we've been celebrating this, and this year, 2021, we've been able to link this to it. For us, it's part of the integration for the National Patient Safety and the Quality of Care Network, which we currently have institutionalized within the country. And this is something that is going to happen moving forward. Now, the conference typically is co-hosted by the Ministry of Health, and then also Ghana Health and Institutional Health Division, and then the Family Health Division, and bringing together all the other agencies and the partners supporting this particular conference. Next slide, please. Next slide, please. So we're going to see a few pictures, and I just want to comment on how the conference participation or conference organization was done. You can see on the left is the Director General of the Ghana Health Service, giving the opening remarks as far as the conference is concerned. And this also clearly shows the importance of leadership in the way we've worked. And so on one part, in terms of the technicalities and the clinical services, and the Director General is there supporting the provision of care. And on the right side, you can see a woman who is gorgeously dressed in a traditional apparel. She's a Queen Mother representing the community. And so you can see how the provision of care and the experience of care, as far as providers are concerned, and then the community as the demand is also concerned, and the learning that we're currently seeing between the provision of care and the experience of care. Next slide, please. So the next slide also is looking at the involvement of partners. You can see on the left, this is the country representative from WHO giving his keynote address. And then on the right, again, in terms of the discussions that were happening, both Afro and Institute for Healthcare Improvement in Boston, Dr. Soji Tete sitting on the extreme right, and they are the support that each of these partners have given to quality of care within the implementation of the National Healthcare Quality Strategies, the Quality, Equity, Dignity Network that we also have in Ghana. Next slide, please. So the next slide is also going to show a picture of the leadership as far as the participation encompassing all forms of leaders at the different levels. So you can see the WHO country representative standing close to the Director General and then the Family Health Division. Paul Jani stands closely behind the representative, the WHO representative. Dr. Rosalind Doe, the Regional Director of Health Service. UNICEF is also duly represented by Dr. Priscilla Wobil. And then just behind is also another Regional Director of Health Service from the Bono East region. Next slide, please. So you can clearly see that the structures in terms of the organization of this year's Knowledge Forum as part of the World Patient Safety Conference encompasses leadership at all levels across the entire health system. So the themes for discussion, among others, I would like to focus on these three, the four that we can see. There was quality improvement interventions, including a WASH and for improved clinical care and patient safety at the point of care. We also looked at some community approaches for patient care. We looked at accountability for improving experience of care. And finally, we also focused a bit more on exploring some mechanisms for engaging the private sector in delivering maternal and newborn health services in quality. So among these were other areas looking at technology, ICT in the advent of COVID-19, and just to mention a few. Next slide, please. So the next slide basically is going to look at the format of the knowledge sharing. There were opportunities for panel discussions at the leadership level. There were opportunities for panel discussions at the middle level, as well as also for the facilities that really do the implementation of the work. So on the left side, you can see that the panel that is seated there are the ones that are right from the facilities that have tested specific innovations and showing great results. Again, a participant presenting from one of their partners, Safe Care, I would say from Farm Access, also sharing some specific areas of the work that they're also doing as far as quality of care is concerned within the health space. Next slide, please. So the next slide is also looking at how some posters that were developed during this period, specific areas that are given opportunities for facilities to share some innovations and to document, some of these great works that they've been able to do and the results emanating from this. So on the left side, you can see one of the facility leads showing with a few participants there looking at the poster and then specific interventions that they put in place, leading to some great results that currently we are seeing. And then it's on the right, we did some oral presentations. I think for those who are seeing a bit of gray hair and all that on the same presenter standing on the right side. Next slide, please. So during these sessions, we also had what we call some knowledge sharing opportunities. There was an opportunity for a photo exhibition. In this aspect, what we had to do was generally to float out a photo contest for institutions and participants to present or submit some photos, which went through some kind of vetting process, and then ultimately some photos were selected. So the photo exhibition, the one that we're seeing on the left, is a picture from the Bono East region. They've been quite innovative in a lot of the things that they were doing. And this picture was the one that emanated as the winner of the photo exhibition. And so the picture on the right side is the Deputy Director of Institutional Care with one of the staff in the middle, and then the Regional Director of Health Service in the Bono East region receiving the award for the photo exhibit. This is something that has also become one of the things that are going to be well integrated in the system, and year on year, tagging on to the World Patient Safety Day celebrations where we organize these conferences. It's going to be something that we're going to continue to do. Next slide, please. So this slide is looking at the part 2 of the presentation outline, and this is going to focus a lot more around the LALA, or the 4 objectives of the network. And here we're looking at the 4 areas, especially looking at the lessons that were learned during the forum, and then also how we have progressed over the period. Next slide, please. So the first one is going to go with leadership, and we do believe within the health space that leadership is everything, and it's the leader who runs the show and makes sure that things are happening the way it's supposed to be. So here, the conference brought together actors in Ghana's healthcare space, as far as the governance and the management-related issues are concerned, both at the national and the subnational level. And clearly, one of the things that are clearly depicted in this was that within the Ministry of Health, the Chief Director was there. Within the Ghana Health Service space, the Director General of the Ghana Health Service, where most of the leaders and the directors of the health sector were present. This also puts in context, the national level interventions and institutional implementations of quality of care standards for maternal and newborn. Next slide, please. So this slide is going to look at building on the progress, and then the subsequent one will look at the specifics of how these are integrated within and the benefits that we're able to accrue during the forum. So on the level of leadership, we have what we call the National Healthcare Quality Strategy, which is actually lapsing this year. There are processes, put in place to review this document. Currently, this is what I would say the overarching quality framework that is guiding the implementation of quality within the space. Now, the network fits into the implementation of the National Healthcare Quality Strategy, and this is what is guiding the activities of the network. We've been able to come up with what we call adapting the WHO quality of care standards for pediatrics, and then also for sick and newborn. Currently, that process is nearly complete, and we're going to come up with these documents as far as running the show leadership related issues are concerned. Then we are looking at strengthening subnational quality management teams in line with the guidelines for implementing the National Healthcare Quality Strategy. If you look at the National Healthcare Quality Strategy, it provides for governance structures at the national and subnational level. So in our setting in Ghana, we have our national, and we have the regional, we have the district, the sub-district, and it fits clearly into the community where the facilities are located. And this is purely the location where there's interaction between the community and the service providers as far as healthcare quality is concerned. From our side, we typically view quality as provision and quality as experience of care. Next slide, please. So during the forum, I would say that there was an opportunity for the Ministry of Health to demonstrate how this implementation of the National Healthcare Quality Strategy, and then also to advocate for partners to support with the review of the strategy, because typically the ministry provides that guidance and the document provides the guidance, even though we know that the content therein is still very factual and functional. It gives that opportunity for us to quickly do that review and then to make sure that we can be up to speed as far as the implementation of the guidelines are also concerned. So there were presentations from the point of care, which raised conversations around the National Learning Forum to inform the health system governance, to advance the quality of care governance and leadership. So typically, there is the National Quality Technical Committee that is meeting every quarter and to deliberate quality-related issues from service delivery and goes beyond that into things related to accreditation and professional regulation, facility regulation, capacity building, postgraduate and undergraduate training, and then the supported staff and support as far as quality of care is concerned. Beyond that, we are looking at also the involvement of the district and the regional level leadership in preparing facility teams for the forum. And it was obvious that, anybody who took part in this, if you look at the posters that were shown, as well as also the oral presentations that were done, clearly you would see the involvement of the middle level and the lower level leaders, playing a very critical role and saying that if you really want to see advances in quality of care, then it's always very important to involve leaders at different levels, and that will drive quality of care at that point. Again, just to mention that subnational leaders currently are being seen as the backbone for implementing quality improvement interventions in line with the WHO standards. Next slide, please. We are looking at action. So once leadership has paved the way, there must be, tangible things that ultimately we need to see. So this part is looking at the presentations from quality improvement teams and projected the impact of clinical interventions through application of quality improvement principles, the tools, and then see how ultimately they were able to showcase some of these great innovations that are being actually practiced in their institutions. So the next slide, please. The next slide is looking at building on the process as we talked about in the leadership strengthen clinical mentoring of primary care facilities through the support of specialist pediatricians and obstetricians, especially to establish strong referral linkages. Again, just to see how this is well integrated, the Society of Obstetricians and Gynecologists, the Pediatric Society of Ghana are well integrated in this work that we're doing. So ultimately, these specialists provide on-site and also remote support to the institutions in such a way that platforms are created so that there's opportunity for learning and sharing. And even if they have to be referrals, they ultimately are able to share and lead, and the clinical leaders are able to provide them some kind of support before the mother or the child is referred, and that improves safe referral processes as part of improving the quality of care. Again, there are also ongoing coaching visits to strengthen health facilities quality improvement teams with skills to implement quality improvement principles. So these are some of the things that currently are happening, getting that kind of strong support from our clinical leads and specialists that may not necessarily be located within a particular institution, but be able to get some of these remote as well as on-site clinical visits that do happen. Next slide, please. So as far as the forum is concerned, there was that opportunity building the capacity of healthcare workers and ensuring specialists for newborn and pediatric care. In addition to this, this comes in the context of Ghana's adaptation of the WHO pediatric and then also the small and sick newborn. So currently we've gone through a number of stages and getting this document ready. The specialists, the pediatricians or the Society of the Pediatric Society of Ghana is playing that leading role to make sure that these do get integrated in the system. And since they are the real implementers of these on the ground and supporting institutions and facilities to provide this care, they are real integrated into the system and they are leading that course. Again, safe maternal care can be achieved with limited resources using quality improvement principles. It became obvious that there were a lot of innovations around how we can improve the quality of care. Of course, the definition of quality is talking about adhering to the basic minimum standards, using appropriate technology, and also coming up with great innovative ideas using minimal resources. Strengthen referral linkages among primary healthcare facilities and the regional hospitals using some form of WhatsApp platforms and some of these, as it were, virtual platforms, to improve quality of care. Again, the QI teams demonstrated the importance of connecting clinical practice to community practice. You would see that in the first, the slide that I talked about, where provision of care being championed by the Director General of the Ghana Health Service and also the Queen Mother championing the community-related issues. We know that that integration is what is going to ultimately make quality achieve its 100% goal, because we virtually view 50-50 here, and ultimately that experience is very important. And so once we have that linkage and then that connection, that clearly shows how we achieving quality. And then we also did some highlights on the need to strengthen Ghana's clinical monitoring system to improve maternal and newborn. Next slide, please. On the learning platform, this forum highlighted innovations that support sharing of QI quality of care knowledge, and then also within and across the various districts and the regions. This was very clear, as you see regional directors supporting their regional teams, district directors supporting their district teams, facility MedSups, and the leadership of facilities, supporting their quality teams to make presentations. Next slide, please. So building on the progress, strengthening the regional level review meetings, and then also the learning forums for sharing knowledge at the subnational level. So we've also included at the moment some quarterly meetings at the regional and the district levels, beyond the technical working group meetings at the leadership level that guides the process of the network. Again, we're supporting the publishing of projects and works in the Ghana network with support from the Research and Development Division of the Ghana Health Service. So most of the innovations that are being tested now and the results that we are documenting are being put together and being shared in the form of a bulletin that is soon to also be rolled out. Next slide, please. So within the forum setting, there was support for the district and facility level coaching to strengthen quality management structures in line with Ghana's implementation guideline for the National Healthcare Quality Strategy. Again, we observed that practices shown by learning facilities will form the backbone for Ghana's continual scale-up of the initiative. So we started with 3 regions with just around 30 facilities. Currently, we are operating in 7 regions, soon to get the next, the 8th region on board. In the past, Ghana had 10 regions, and currently we've been able to separate some of the regions. So we have 16 regions. So very soon we're covering about half of the 16 regions. That is going to be about 8. And we are working in 120 facilities now and over 36 districts that we're currently working in. So clearly, you would see that we continuously scaling up, rapid scale up over the period with the support of other partners who are also doing some great work in some of the districts and some of the regions. We have adopted the strategy of 1 hospital, 2 health centers, and that are located within the district and the sub-district level. And ultimately, based on the leadership capabilities of the regional director and the team, they are also already scaling up some of these innovations during their various regional meetings and their district meetings to share some of these great ideas. Ultimately, we are not going to sit down to wait until we reach a particular district, but then the opportunities that are coming from one district that are being shared at such fora are already being tested in other districts that are not really part of the network. But then that is where middle level and then also district level leadership play a very critical role in making sure that things do happen. And this were some of the things that were clear and obvious during the forum. The forum also highlighted the benefits of subnational level learning forums in facilitating knowledge sharing among quality improvement teams and the need to strengthen them. So these are things that are also coming up in the next steps and how there's going to be great support in making these happen. Next slide, please. So this is more related to accountability. And again, in terms of accountability, I would take it up right from the top level coming down into the community. So there's a National Quality Technical Committee that also meets every quarter to look at related issues. That also has community involvement. We also have the Network Technical Working Group at that level and scaling down into the region and the district. So there is great evidence of the use of point of care data to help improve and sustain quality of maternal and newborn care. And then also Ghana's strategies for accountability through community engagement was a major highlight, which we talked about. And so there were great opportunities for what we call the community scorecard, which is on the Ghana scorecard. And there were great presentations on how the community have been able to support quality of care from their point and how they value themselves in making sure that they benefit quality care as part of the demand process within the health space. Next slide, please. So building on the progress, there have been quarterly review meetings at the regional with the regional quality managers. This piggybacks on the what the National Healthcare Quality Strategy proposes, that we'll be able to pool regional level, subnational quality related issues of the agencies. And so every region at the moment has what we call a regional quality manager and is able to form a quality management team to guide the process of implementation of the National Healthcare Quality Strategy, as well as the network interventions that are going on. Again, administration of the exit interview, the postnatal exit interview questionnaires, also to measure the experience of care in all the network facilities. This is not just there, but again, regional managers and regional quality managers and regional directors and the regional health management team have been able to scale some of these things up already in non-network facilities to showcase how we can get the community and our patients and their family experience better care when we have to meet and provide care for them. And then the scale up of the implementation of the Ghana community scorecard to strengthen community participation for healthcare accountability. Here, Ghana intends to do a cost analysis research to value community contributions to the quality of care in maternal and newborn. Next slide. I must say that there have been some great innovations by the community in some areas. In fact, communities have been able to provide incubators where it has been important. Some of them have supported in kangaroo mother care settings where mothers are being taught within the facility. There have been great instances where facilities, the community people have actually put up a facility like a maternity unit befitting the community, and they are playing such role. And that partnership has been quite innovative and is showing great results in the areas where the community have been very instrumental and where the providers have embraced the community and they are working together to improve quality. So within the forum, presentations reveal the benefit of Ghana Community Scorecard as a social accountability tool and how useful it is for resource mobilization for improving the quality of care. So all these were also showcased, and the community members were able to showcase what they've been able to do to improve quality in their own communities as far as the service delivery related issues are concerned. We also use the postnatal exit interview questionnaires was shown there, and it has been very useful and be able to measure the levels from one point and then also to make sure that we can improve, because we also do review these interviews. So at the moment, the research division is also putting together some of these results at the network level to be able to showcase this for improving quality. The quality improvement teams also demonstrated how effective data monitoring translates into improvement of quality of care within the health facilities. And all these things were very revealing during the forum. Next slide, please. So as we get closer to bringing this presentation to a close, we also observe some cross-cutting related issues beyond the LALA that we continue talking about. And we say that participation of multi-agencies and partners right from the conference planning stage and ensured stakeholder buy-in. So before this conference was planned, or before we could even harness these opportunities to integrate this into the quality of care patient safety conference, there were a number of engagements. And as you bring all these agencies together, as you bring partners together to think through what we're currently doing, it gave us some great results. So we bring all the other partners who are in the maternal and newborn space, and whatever they were doing, opportunities were there for them to share beyond the network and facilities. Involvement of the regional quality management teams in submitting the competitive abstracts from learning facilities to ensure the engagement at all the levels. So they had to vet some of these abstracts before they could submit it, into the conference. And that also clearly shows their involvement and their leadership as far as this conference, and then also rolling down quality of care. And as we look at sustaining some of these gains, that's one of the ways that we were able to see some innovations around there. And the third one was the immediate post-conference assessment also helped in identifying the gaps, which ultimately during our quarterly review meetings, we're going to talk about them. And then as we plan towards the 2022 Quality of Care conference and the World Patient Safety Day celebration, and how we gotten this integrated into our systems, these are opportunities for us to see how we will be able to ensure these things do work well. Next slide, please. So this part 3 basically is going to look at the next steps from the great forum and the good works that have been going on, and then this opportunity for knowledge sharing. Next slide, please. So these next steps, the first one is looking at follow-up on action points from the recommendations that emanated from the conference. And as I mentioned before, one of the cross-cutting related issues, as we review the immediate post-conference related issues, there were a lot of great recommendations that came out of this conference. And these are great opportunities that we're going to include all these recommendations into the way we are working, into the opportunities for our next, the 2022 conference and the knowledge forum, and that we're going to come up. The second one is looking at the support the network regions to hold regional level reviews, and then also learning forums like we did at the greater national level, because this is also going to give opportunity for us to learn things at the local level, at the regional level, that will feed ultimately into the national forum, which has become one of the things that we're going to do moving forward year on year, and then to institutionalize this as an annual event. we do appreciate and we are happy that the World Patient Safety Day has come to stay on the 17th. And so we always plan some of these quality and safety related issues around the ceremonies and celebration of this. And Ghana has also adopted the World Patient Safety Day as a day that we're going to celebrate within the national, the regional, the district, and ultimately at the facility level. Next slide, please. So I would like to thank each one of you for the opportunity, and I would hand over now to Rosalind and Priscilla Doe as they take us through some clarifications, some questions, and some contributions from our participants who have joined us. Thank you very much.
Thank you very much, Ernest, for that brilliant presentation. Thanks for sharing the various lessons that came out of the Learning Forum. The chat box has been very busy. There are a number of questions. As Ernest indicated, this presentation was made on behalf of himself and Dr. Mary Ashenyo. So they are both available to answer the question. We'll pick a few of them. Some of them are being answered in the chat box. So kindly visit the chat box also. You may find some responses to the questions you've posed there. But to start with, Ernest, Raz wants to know, are QOC, quality of care indicators, being tracked regularly in the DIMS? And if so, which indicators are being tracked? And how are we making sure that quality is maintained? And another participant wants to know, can you please say more about how you are addressing accountability? Again, indicate what platforms are being used. So maybe you can take these two together, and then we'll take the next set of questions. Over to you, Ernest.
Thank you very much. So I first want to thank the organizers again and for participants who have shown keen interest to listen to the presentation and also seeking some clarifications in this. First, I would say that my colleagues are also there to also add on to whatever we're going to say. So I don't want to be that greedy to take the entire presentation. So colleagues will be there to also provide additional information. But just to answer the question, I think the first one was related to the indicators that we are tracking. So when Ghana joined the network, the way the Ghana health system is very pluralistic. So we came back together and look at some of the indicators that were already being collected, especially for outcome indicators are already documented in the DIMS. A couple of process indicators, especially on the side of experience of care, were indicators, some of the indicators that we were using some kind of proxies, including our exit interviews that we do. We do have what we call the client satisfaction surveys that we also collect, in addition to the exit interviews that we're doing. And then also the community scorecard provides for opportunities where we collect some of these indicators. So these indicators being so good, as we worked with the Deputy Director Health Information at the time, who is currently the Deputy Director General of the Ghana Health Service, we were able to work together to make sure that these indicators are already in our depth. So for us in Ghana now, that is not really so difficult. Some of the indicators are proxies. By and large, majority of our indicators are inputted into the depths. And so quarterly or monthly, we are able to chart these indicators and also to follow them through using various quality tools that we are working with. So this is what currently I would say is happening in the country. On the side of the okay, so I think part of it also fits clearly into the accountability related issues, but if I need to expand a little bit on the accountability related issues, then
please go ahead, Ernest.
Okay, so as we mentioned, part of it is, I would just want to stress right from the top coming down, we're looking at this quarterly data review meetings that, as I talked about, starts from the National Quality Technical Committee, and then also the network itself has a technical working group that we also meet every quarter to review the progress of network interventions that are going on. And since it is also wide enough, accommodates various providers of health service within the country and our development partners, together with the various societies like the Pediatric Society, Society of Gynecology and Obstetricians, where we pool all our resources together. This gives an opportunity for us to showcase and to discuss the implementation of some of these interventions that are currently going on within the space. Again, we've also instituted the quarterly review meetings at the regional level, where the regional quality managers are leading this within the space. The administration of the postnatal exit interviews are opportunities for accountability. The community scorecard also is another opportunity for accountability. And as we continue to scale up some of these interventions across the entire network, these are some of the accountability opportunities that are already ingrained in the system for us to in terms of sustainability, for us to be able to move this forward. So this is what at the moment Ghana, just to mention a few of some of the things that we are doing as far as accountability within the space for maternal and newborn is concerned. Thank you.
Thank you very much, Ernest. So the number of questions around the community engagement for quality of care for maternal, newborn, and child health. And I think this one I'll direct to Dr. Mary Ashinyo, who is the Deputy Director, Institutional Care Division in charge of quality assurance. So just trying to summarize them, in what ways are communities engaged in strengthening quality of care, both the experience and provision of care at the subnational level? And then some other participants wants to know how communities are involved in the development and oversight of the quality of care policies, standards, and systems. And do you think accessibility should be considered in the learning forum? How we can get the communities to participate in this? So Dr. Ashinyo, maybe you can take these together, and then my colleague Priscilla will take the next set of questions. Thank you. Over to you, Mary.
Okay, so thank you very much, Dr. Doe, and thank you, Dr. Siedu, for doing the presentation on our behalf. So I must say that one of the good things about Ghana is that we have a very long-standing relationship with communities when it comes to improving quality of care. So for instance, our patient charter dates as far back as 2002, which will be 20 years next year. So that document alone empowers patients to be part of the quality of care process in defining what quality they want to see. We also have a policy that ensures that hospitals conduct client satisfaction surveys twice a year, every 6 months, and then action plans are drawn and they are implemented. We also have systems for managing client complaints at all levels of care. And let me say more recently is the community scorecard, which Dr. Siedu has mentioned in his submission. That gives the opportunity to patients, communities to be able to assess the care they have received from our healthcare facilities. We have started looking at the data on the community scorecard, and we realized that although the assessment is done in the absence of the healthcare provider, the results are given to the healthcare provider to enter into DIMS. We realize that for the indicators that are perhaps perceived by the health worker as directly linked to the service that they provide, for instance, the question that will say, do you think the healthcare worker was respectful during care? Those indicators seem to be doing very well, but those that the healthcare worker perhaps perceives as not directly related to them as frontline, but actually related to managers. For instance, when we say, do you think this hospital has good leadership, or do you think NHI reimburses the facility on time? You realize that those indicators are not doing so well. So there are discussions about raising the bar in terms of what communities have to contribute to quality of care. given what we have achieved through the community scorecard so far, we think that even the community members themselves can be trained to do the data entry so that we can be seeing a very realistic assessment, and then the voice of the patient will continue to be at the center of care. We have also had patients participating in the Patient Safety Conference since 2019, and that has been a very exciting moment whenever we have to hear the voice of the patients. This year, it was a Queen Mother and her team who attended, and they gave us a very objective reflection on how they see the care that we give them. So I would say that, yes, communities are at the center of the quality of care that we provide in terms of design and implementation. But of course, there's so much more to be done. Thank you, Dr. Doe.
Thank you very much, Mary. I think the next set of questions are around adapting and implementing pediatric standards, and then aligning with the Every Newborn Action Plan and maternal and newborn health broader strategies. And I would request if Dr. Sego Moses will be able to answer these questions. So the first one is that when will the quality of care standards for pediatrics be available? And will they address quality at the community level? And the second one, which has to do with aligning with ENAP, does this learning forum also take the ENAP, Every Newborn Action Plan, into account? So Dr. Sego Moses.
Thank you very much, Rosalind. And let me add my voice to the great presentation and participation of everybody in asking these questions. Yes, the pediatric quality of care standards are currently being adapted. We started the process earlier in the year, and we are doing this in collaboration with the Pediatric Society of Ghana. And as I speak, we've had one meeting already to review a draft, and we're about to hold the second meeting, which will be a validation by stakeholders. And that is scheduled for next week, the 9th, where we are bringing about 50 plus stakeholders from various levels across the country together to look at what we have proposed as the Ghana adapted version. And once we finish that meeting next week, we have another couple of weeks for the consultants and the technical working group to finalize it, and then it will be ready for use. In all our work, including other previous documents that we have produced in country, we have made a great effort to align with INA, so and other global targets. I think this, I hope this answers the question. Priscilla, over to you.
Thank you, Dr. Sego Moses. And yes, indeed, the Every Newborn Action Plan, the national strategies clearly align with it, especially the current National Newborn Health Strategy and Action Plan for 2019 to 2023 is clearly aligned, and all these have been factored into that. So the next question will be around aligning with nurturing care agenda. And after this, I would hand over to my colleague Rosalind to continue with the questioning. And I think for this one, either Dr. Sego Moses or Mary or Ernest can take it up. So the question is, were some aspects of nurturing care for the newborn considered in the quality of care agenda? Example, questions around responsive caregiving, stimulation of a newborn, early learning aspects in the neonatal period. So more of responsive caregiving and then early stimulation, where these captured in the quality of care program. I think Dr. Sego Moses will be able to answer this question.
Yeah, thank you, Priscilla. Fortunately for Ghana, we launched the Nurturing Care Framework way back, I think it was 2018, soon after the World Health Assembly where it was launched. And so issues around nurturing care have been foremost in our mind, and we have tried again to integrate these issues into our various strategy documents. And so, yes, the answer to the question is yes. We have tried to align to these, and there are attempts at the various facility levels to improve the way that we address issues of nurturing care. Thank you.
Thank you. Just to add to the response that the National Kangaroo Mother Care Guidelines and Training Manual has clearly captured nurturing care, responsive caregiving, and early stimulation in the guideline in the Kangaroo Mother Care Guidelines and care for the low birth weight newborn. That has been captured, and as Dr. Segu Moses said, it is one of the key areas in the National Newborn Health Strategy and Action Plan. Over to you.
Thanks,
Rosemary.
Priscilla. Yes, thank you very much. So, Ernest, I think you can take the next question since you'll be stepping out soon. You can answer that and then you give us your final words before you step out as we continue with the questions and answers. A participant wants to know is whether the patient experience data is useful or usable and can easily be collected. I know Mary touched on it a bit, but how accurate are they and how does that compare to quality data?
Thank you very much. Rosalind, are there any other questions coming up, or I can go ahead and answer this one?
Let me just add another one. Can you also explain how you provide findings from the post-assessment to the facility managers? I think that's referring to the experience of care data. How is the feedback given to the facilities to ensure that actions are taken? Thank you. You can take those two for now.
Thank you very much. So I think, like you mentioned, aspects of it were delved into by Dr. Mary Ashinyo based on the experience of how the community scorecard currently is being implemented on the ground. So for in terms of accountability, in terms of experience of care data that we are collecting, if you look at the community scorecard in itself, we know that there are a few gaps in terms of the data being uploaded, but the good news is that the data is uploaded, and so we can do some work with that. There is an opportunity for some kind of action to be taken. So after they have done the assessment, they identify some gaps. The Community Health Management Committee, the expanded group, are able to look into the gaps that they've been able to identify and also come up with some innovative ideas in how we can address this. And this is where it's done in concert with the providers of care as well. So for our system, there are obvious and visible or I would say tangible results that we have seen as far as the impact of the community scorecard is concerned, because they have translated those innovations or those identified areas of improving the system. So if there were things around even a purchase of some equipment into the facility, these are tangible things that the community have been able to do. If there were construction of a ward or some structures or infrastructure, these are tangible things that we are able to see and document them. And so this is where our knowledge sharing opportunity has also given us that that space to showcase some of these great innovations, and these are also uploaded onto the community scorecard. Like Mary mentioned, if we get to the point where the community have what it takes to actually load the data themselves and to go there and see what is going on, we know that in the past they've generated some healthy competition among communities. So if a community has some great innovations that it's able to do in one community, the other community is able to see, because I mean, as far as the community scorecard is concerned, we've made it quite easy to see. Once you see red, it means things are not going well. If it is yellow, things are, you know, here and there. But if it is green with an arrow showing up, it means that they are improving what they are doing, and they are doing it well. And sometimes it generates some kind of healthy competition among the communities, because I see that community and getting, you know, all green, and my community is red and yellow, and you know, it comes back to the community to feel that yes, they need to do something to support. So I'll say that in terms of the measurements, they are tangible, you know, outcomes of some of these things that clearly, you know, do manifest and are also uploaded as results from the specific interventions that they've been able to put in place following identifying some of these gaps. I think again, my colleagues can also add on to this, but the postnatal exit interview, in terms of the assessments that are being done, yes, at the local level, it's being collected and discussed, you know, with the quality teams, and then this is passed on to the regional teams for them to look at it, and it informs how the community or the mother and the baby leaving the facility together with the family are perceiving the way that service is being provided. I think Mary can also add a bit onto that, and so basically that is what I know about how these experience of care indicators are impacting positively in the way that we are providing quality service in the country. Thank you.
Thank you very much, Ernest. Before Mary adds on, Mary, there are a couple of questions still around the community scorecard. So let me just add on those questions, then you can take them together. There are a number of questions around sustainability. So is there a specific strategy to ensure long-lasting and sustainable implementation? And then there's another question asking about how cost-effective the community scorecard is. So Mary, over to you. You can take those two. Thank you.
Okay, thank you very much, Dr. Doe. So in terms of sustainability, I would say that this is an approach that is really owned by community members and the community health management committees who actually do this implementation with the community health officers. They are recognized as part of the governance at CHIPS level. So these are communities that are already part of our health system for many years. Now they have a tool that empowers them to institutionalize their contribution to quality of care. So I think that as long as these teams are part of our governance system, they are sustainable. So far, we have had, I think, about 24% coverage, but that is again of CHIPS facilities. We are now making efforts to be able to scale up the implementation to include all district hospitals, all health centers, and then the other CHIPS that are not involved currently. So we are hoping that by next year, early part of next year, we will set into motion these efforts to be able to scale up across the country. The good thing is that once we are also able to scale up across the country, then we also have a network right from CHIPS to sub-district to districts to even the regional hospital. And that chain of leadership can then be also seen as an additional effort for sustainability. For the cost effectiveness, when we go around and interact with the communities, there is anecdotal evidence that yes, indeed, it is very cost effective because the communities themselves are mobilizing resources that are used in the implementation of the activities on the action plan. But we plan to conduct a study with the support from WHO, We plan to conduct a study that will scientifically, or let me say systematically, measure the cost effectiveness of the contribution we are getting from the communities. So I would say that ahead of the study, we get that feedback that it is cost effective. And hopefully when we are able to conduct that study, that will be an additional backup to prove that indeed this is a cost effective way of improving quality of care. And having demonstrated that, then we can then also add on more responsibilities that we can push to the communities to be able to support quality of care. Thank you.
Thank you very much, Dr. Ashinyo. Ernest, are you still around? There's a question on how do we integrate quality of care within all other programs beyond maternal and child health. So the participants wants to know programs that tend to be vertical in some countries like HIV, TB, malaria. How can we incorporate the lessons being learned from the maternal and child health across the various programs?
Thank you very much, Rosalie. So if you look at the National Healthcare Quality Strategy, it gives some kind of guidance in how we can integrate quality of care across the entire health spectrum. So I would say that maternal and newborn care are just aspects of what we do. If you come to the institutional care division of the Ghana Health Service, where Mary leads the quality-related issues, there are a number of areas that are looking at improving real hospital care related issues in surgery, in improving medication use, and improving infection prevention and control related things that are beyond or that are outside of maternal and newborn. So if we've been able to use the same quality of care network to improve, let's say, interventions within tuberculosis and also HIV related issues. And so when we were developing the National Healthcare Quality Strategy, it was not specifically for just maternal and newborn, but it encompasses all the health-related challenges that we are currently working on. So typically, using your quality planning tools, as far as the quality teams are concerned, they look at gaps that they can identify within a particular institution. So if it is within something around HIV or TB or even diabetes care or hypertension or stroke cases, they would be able to come up with some specific innovative ideas based on using the various quality planning tools, like using a Pareto to look at where you should put in, where you should concentrate your efforts. You can do your root cause analysis using your fishbone or 5 whys to identify, the root causes of those specific things. You use your PDSAs to come up with some, to identify some of these specific change ideas that you're going to test them to gain some kind of confidence for scale up and things like that. So I must say that it is not limited to maternal and newborn, but we would say that we just piggybacking and taking advantage of some of the opportunities around the space of maternal and newborn, which are also real priority areas within the health space, in addition to other priority areas that we can equally work on. So there are great opportunities, and this is where the regional and then also the district quality management teams can support the facility quality management teams once they have been able to identify these health area gaps and how they can come up with innovative ideas. So even for the community support, as part of the objective 3 of the implementation of the National Healthcare Quality Strategy, it is not only limited to maternal and newborn, but other areas. So for example, if there were things related to referrals, they're able to support in doing this. If they are related to increasing the coverage of let's say, even immunization, you can come up with innovative ideas within the quality space to be able to improve services around this. So I think there are great opportunities, and the leadership of the various service delivery agencies are able to support the facilities in identifying those specific gaps in those areas and how they'll be able to come up with innovative ideas to address them. Thank you.
Thank you very much, and it's great to know that the concepts cut across and can be used in all other areas. Priscilla, I think you can take on the next set of questions. Over to you.
All right, thank you, Rosalind. I think the next set would be around improving referral systems. And I think Mary would be able to answer these questions. So Linda wants to know how referral linkages were strengthened, and also the training and capacity building that was done to strengthen these referral linkages. And then the second one is from Christina. She wants to know that she's saying that in many regions in Ghana, there are no ambulances for neonates. And what is the Ghana Health Service doing to overcome this challenge in order to have smooth referral systems for sick neonates? So I think Mary can take these and then we would move to the next set.
Okay, thank you very much, Dr. Wabil. So I will take the first question on how we have been able to improve on referrals within the network and maybe also beyond. We have seen a growing use of technology to improve referrals. For instance, at sub-national level, district levels, there's that creation of simple platforms such as WhatsApp platforms, where immediately a child who needs a referral is identified. There is immediate communication with the referring facility to the receiving facility so that arrangements are made to be able to initiate treatment immediately the patient arrives so that the third delay is shortened. The challenge has been that these technologies are not actually recognized by our referral policy. So so much as they have been best practices, we have not been able to institutionalize them yet. So next year, one of the key things we want to do is to be able to bring together all these lessons that have been learned by using simple technologies to improve referral services. And then we update our referral policy to include all these so that we can institutionalize some of those lessons that have been learned. We have also tried to improve referral using triaging in healthcare facilities, so that using simple tools, the healthcare worker is able to quickly identify those children or mothers that need to be referred immediately so that they do not deteriorate before that referral is instituted. Then we also have specialists who conduct visits to the lower levels to support them based on indicators that they are tracking on the referral practices from the lower levels. So I would say a range of lessons and best practices that have been tried through QI approaches in various sub-national healthcare facilities. And I think that we look forward to taking them up and institutionalizing them so that other facilities can also learn those approaches. In terms of availability of ambulances, I think this is a very, it's a national gap. And we have the National Ambulance Service under the Ministry of Health that is responsible for the ambulance services. So what Ghana Health Service does is constant collaboration and negotiation and discussions with the ambulance service to see how these ambulances can be made available. Government procured some ambulances under the One District, One Ambulance initiative. Again, there are challenges about who provides fuel for these ambulances and also their maintenance. So I would say that we are not there yet, but we recognize that these gaps are very important to bridge, and we are committed to do that gradually. So that is what I'll say for the ambulance availability. Thank you, and over.
Thank you very much.
Thank you so much.
Maybe I just want to add something small from the perspective of the ministry. So I think that it's one of the gaps that we also identified during the conference, and some of the things that we need to address. So I think it was obvious that there were some basic things that we needed to have, as far as one, the numbers of the ambulances are concerned, and then also in terms of the functionality, what is in terms of equipment availability within the ambulance. So it's one of the things that have been identified as a gap that we need to fill, and we have duly communicated that to the National Ambulance Service. And of course, the ministry is supposed to ensure that we make some of these provisions available to improve some of these referrals. So just to add that to what Dr. Mary Ashinyo has just talked about. Thank you very much.
Thank you so much, Ernest and Mary. So I'm moving on to the next.
Priscilla, if I
Yes.
may also add on specifically for improving referral for newborns. I think one of the areas that we have focused a bit on is also improving pre-referral care. And we try to link lower facilities with specialists at higher levels so that before they even refer, they can be given some guidance on pre-referral care before the child goes on the journey. And we also have worked with communities in some districts to harness community transport systems so that they will not delay. We are talking about public transport. They will not delay or charge exorbitant fees or insist on patients or clients paying them before they transport newborns and women who need to be referred. And these have worked very well in some communities, and other communities are also taking them up. We also plan to collaborate with the National Ambulance Service and train their staff specifically for newborn issues to ensure their safe transportation to the referral levels. Thank you.
Thank you so much, Dr. Segu Moses. So I have a couple of questions around health worker mentoring coaching. And the first one is around the strategy that was used or that is being used to mentor and then conduct coaching visits. Specifically, who are the key players? How frequent are these visits? And then also a bit around how these mentorship sessions are linked with the primary healthcare level facilities, especially during this COVID-19 pandemic. How is it working? And then there's also a question around, I think these ones, Mary and any of the other panelists can take it. And a question around how neonatal nurse specialists who are trained in by the Ghana College of Nurses and Midwives been involved in all these quality of care issues. So if Mary or Ernest or any of you could take this. Hello, Mary. Dr. Ashinyo.
Yes, please, Dr. Wobil. So I'll take the one on coaching. So let me say that most of the time, the quality improvement or quality management interventions that we have implemented so far come with coaching as one of the strategies to reinforce learning and also provide support. However, as part of the National Healthcare Quality Strategy launch from 2016, supportive supervision was one of the strategic objectives. And so we also implemented a national supportive supervision program. There were guidelines on supportive supervision that were developed and also tools that have approved indicators across programs and across all levels of care. Then we also identified regional coaches who were trained on these tools and also on the soft skill of mentoring or coaching. And so on quarterly basis, we have these coaches who go from national level to regional level, and then the regions also go to the hospital and the district level, and also the health centers and the CHIPS level. So that is the arrangement for supportive supervision, through which we do a lot of coaching and mentorship for all programs, including maternal and child health. And then we also have virtual platforms where we provide some mentorship. And these became very handy, especially through the COVID outbreak, when we had to reduce face-to-face interactions. And so we also used virtual platforms to do a lot of virtual mentorship, although as part of supportive supervision, we usually insist that the mentor and the mentee have a physical interaction. So I would say that this has been the arrangement. And per our policy, it is usually a quarterly activity. But depending on the duration of the program and what is being monitored, we have also seen programs that have monthly supportive supervision visits for mentoring and coaching as well. Thank you, and over.
Thank you very much, Mary and Ernest, Dr. Segun-Moses. I think we'll just take the last round of questions. There are a few others that have been answered in the chat box, so kindly refer to the chat box as well. And then a couple of requests that I think the Secretariat will have to take up. Somebody is requesting if the recommendation and the presentation can be translated into French. So the Secretariat will look at that. And another is requesting for the link to the KMC guidelines, if that can be shared. I think the last question I see here, do you have learning collaborative sessions in place with network facilities at regional level? If in place, how do you ensure sustainability in terms of finances and any lessons to share? Do you think the last one, is it possible to share the link? Okay, again, the link for the KMC guidelines. That's it. So I think the main question is, what happens at the regional level? This was a national level forum. How are districts and regions able to learn among each other or within the districts at the regional, the sub-national level? Maybe Mary can take this. The others, as I said, I request that the Secretariat will have a look at. Thank you. Mary, over to you.
Yes, please. Thank you, Dr. Doe. So let me say that in the design of most of our quality programs and projects, we ensure that regional learning is part of, it's a key activity as part of that implementation. I think from Dr. Siedu's presentation, this is something that is also coming up in the KOC network to be able to strengthen regional learning forums so that regions can also bring districts together to exchange knowledge and lessons that they have learned through quality improvement implementation. Beyond these very explicit learning forums or standalone forums, we also encourage regions to integrate some of these presentations and learning into their review meetings. So when the regions have regional performance review meetings, we encourage them that they should let the districts do presentations at those meetings to encourage learning. So going forward, it is one of the things that we have to support regions to be able to do. But across most of our quality programs, these platforms really exist. In quality improvement for HIV, TB, and malaria, we have these platforms. In quality improvement for WASH, we have these platforms at regional level and even sometimes at district level. And I think within the network, although we had not pushed it a lot, some regions by themselves have also been able to introduce these platforms where some of the teams have come together to learn. Thank you.
Thank you very much, Mary, and thanks again, Ernest and Dr. Sigo Moses for answering these questions. So I'll hand over to Martin to round up. Over to you, Martin.
Thank you very much to the Ghana team. This is fantastic. It's really a pleasure to hear these presentations and also you taking time to answer these questions. Thanks very much for the participants. It's been a very lively session with a lot of questions. I believe we did not even have time to address all of the questions which are there. So we thank you very much for that. Just to rest assured that we will share the recordings, the slides, and we're working also with the country team in Ghana to update the network website with all the implementation and progress documentation that's been highlighted today. So please stay engaged for Ethiopia webinar, which hopefully will take place soon. And the Uganda team is also having their national forum this month. So we look forward to organizing their webinar too. With that, once again, thank you very much, and please stay engaged. There's upcoming webinars in the series, as I mentioned, and please also visit the website, which is in the link at the bottom. And you can also read more about the National Forum series in the link highlighted in the slide. But as mentioned, this will be shared with you so you can have a look at it by yourself. Thank you very much. Have a wonderful day, evening, and night. Thank you. Bye-bye.
All right. So